There are a rising number of reported illnesses and even some deaths in the U.S. linked to vaping. And now there is growing scrutiny around vaping and just what we know about it, including those that are derived from the cannabis plant. David Hammond is a professor at the University of Waterloo. He's been studying vaping among young Canadians, and we should note he's previously served as an advisor to the World Health Organization on tobacco control policy. Thanks for being with us.
My pleasure.
The reason that I think it's important that people know that last bit is there's a really interesting kind of parallel here, right? Because some of the big tobacco companies are in the middle of this because they saw vaping as a way to keep selling a product that was so-called safer. I want to start with your thoughts on what is not safe. In other words, we know that there are some kind of illnesses. There's a lot that we don't know about what's caused them. What can we safely say that is true about the harm of vaping?
Well, vaping is a mode of delivery, and the harm is probably going to be what you're vaping. Now, vaping, we can say, will be less harmful than smoking. We really don't know how harmful it'll be in the long term. It'll take us 10 or 20 years. But what we've seen in the last couple of months is more than 800 cases of severe lung disease in the U.S., including about 13 deaths. The CDC says that about 80% of those are from THC or cannabis vaping. And the idea is that there may be some sort of contaminant in the liquids that people are vaping that is causing these serious diseases. You would hope with proper manufacturing and standards that you wouldn't see some of those contaminants. And then it's just a question about what the long-term risks are.
So, I mean, if there's good news in that, and obviously people are sick and some have died, so I will keep this in context. But if there's good news in that assumption, it's that the actual delivery method isn't necessarily the problem. Although, can we say that with certainty? Do we need more research to know whether vaping, even vaping non-nicotine or cannabis, in other words, vaping just flavors, which some people do, is safe?
Well, we can't say it's safe. We can say that it's a lot less harmful than smoking. That's not a great endorsement because smoking kills 1 out of every 2 or 3 long-term users. So this is why the message is for 2 groups. If you're an adult smoker, you can probably reduce your health risks if you exclusively switch to vaping. If you're not already smoking, there's no reason to be vaping because at some level you're inhaling chemicals and some of those could be toxic. So obviously, step 1, no contaminants, none of these acute health effects. Step 2, we really don't know about the full risks, but it'll probably be less than smoke.
And what we have seen from the U.S., and again, we're cautious because we know that there's still investigation going on, but to the point that you're making here, it does appear to be tied to what is in the vaping device. And in the U.S., THC seems to be a culprit. Can we start to say, THC may be harder on us than CBD? Do we know enough to kind of start to parse out what's good and what isn't about the parts of the cannabis plant?
Yeah, it's probably not a cannabis-specific contaminant. It's probably something that they mix. So some of these have been black market. So the idea is that people try and cut the THC oil. So it's probably something that's been added to the solution rather than specific to cannabis. But look, what this means is that vaping's not going anywhere. Nicotine e-cigarettes are a huge industry at the moment. We are about to legalize THC oils for vaping at the end of this year. So whether you're a consumer, a company, or a regulator, we need to get our heads around these products, make sure that there's no excess risks, and learn a little bit more about what sorts of chemicals or liquids should and should not be in these products.
Given the work that you've done on tobacco control, does it surprise you the way that these products have come to market? And I guess the context that I would put around that is, if you know anybody who's tried to bring a legal drug to market, You know how difficult it is to show efficacy. First of all, that it actually does what it claims to do is a huge hurdle, which I don't think cannabis has been exposed to. And then that it won't do harm, unintended harm, another huge hurdle. Why such a big push on drugs that could save lives and very little done on something that really is, for some users, purely recreational?
Yeah, you're absolutely right. And it's interesting that none of the big e-cigarette companies have actually put their products through to be regulated as a medicine or medical device. They could, but they haven't. And so what we have is a much different recreational drug market than we had 10 years ago. You have e-cigarettes, which deliver highly addictive levels of nicotine sold in corner stores. And we now have products like legalized cannabis. The regulations around them beyond some product standards are things like, should you allow flavors that appeal to kids in either of those products? Where should they be sold? And how do you restrict the promotion? Because as you say, these are recreational drugs. They have not passed any specific standards as a medicine.
Do you think that we will get there, that we will ask some of them that are making claims to do the standards that we expect from drugs?
Well, I think so. I mean, the problem we've had with the increase in youth, the question is, well, how do we stop that and better target adult smokers? Well, a therapeutic route is one of them. And then you mentioned CBD. So CBD is the non-psychoactive, one of the cannabinoids, the chemicals from cannabis.
Right.
It doesn't get you high. All sorts of natural health products with unproven claims, those CBD products in particular should be subject to more scrutiny.
All right, David, great to have your thoughts on this. Really appreciate it.
My pleasure.
David Hammond is a professor in the School of Public Health at the University of Waterloo.